Hi everyone, my name is Mohammed Alsayid and I'm an internal medicine hospitalist. I work now at University of Massachusetts, and I would like to thank you for coming and listening to our first episode of exploring pathways of medical specialties. I started this series and I wanted to start this series with multiple interviews with medical specialists in the United States. My goal is to introduce those specialists in the United States to the medical students and to the medical residents. So you guys can have an idea about those specialties. And we will go through different specialties in the academic and private practices. So in that way, you can understand the type of practice and the type of training that they get in order to maybe pursue that specialty in the future. So basically, we're gonna talk in the next episode. So we're gonna talk today about endocrinology, and our first episode will be with Dr. Ula Abed Alwahab, and she is originally from Syria, and she graduated from Damascus University School of Medicine. She did her medical residency at Emory University in Atlanta, Georgia, and she pursued her fellowship in endocrinology at Cleveland Clinic Foundation in Cleveland, Ohio, and she's currently a clinical staff at Endocrinology and Metabolism Institute at Cleveland Clinic Foundation, and she is also an assistant professor of medicine at Case Western Reserve School of Medicine. I'm really honored to have her here with me, and I'm really happy that she's going to be our first guest in the series. And I would like to ask you, how are you doing, Dr. Ula?
I'm doing great. Thank you for the introduction. I hope you're hearing and seeing me okay, because I can't see you anymore. I can't see your camera anymore. I can hear your voice only.
No problem. Yeah, we can hear you and we can see you. And I would like to start with a very broad question. Can you tell us briefly about yourself?
You pretty much summarized me. My name is Ula Abed Alwahab. I graduated from Damascus University in 2009, and I joined Emory University for residency. That was in 2010, and I finished residency and went straight ahead to fellowship at the Cleveland Clinic Foundation for 2 years, clinical fellowship, and I've been staff with them for the last 3 years now. And my position is a clinician plus an academic position as well. So.
Thank you so much for this introduction. And I would like to start with so you're specialized in endocrinology, and I would like to ask you, why did you choose endocrinology as a specialty?
First of all, endocrinology, since medical school, I like the material. During medical school, you don't get enough exposure to the real life. So during medical school, you maybe like some subjects, you might like, multiple ones like endocrinology, and you like maybe a little bit of nephrology. When you go through residency, that's when you get the chance to get exposed to the real life of the subspecialty. So, so during residency, I did a rotation in endocrinology in my first year, but I also worked a lot in research in endocrinology during residency, and that kind of gave me an better idea about the subspecialty, and kind of excluded the other subspecialties from my mind. So that basically solidified my decision to go for endocrinology.
So I hear from you
And
that
I'm happy with it.
well, that's really glad to hear. So I hear from you that you did research in your residency. Can you tell us like how did you get the chance to do this research, and how did you find your mentor?
So basically, I can tell you this is, we're going to talk about it a little bit later, but I hear a lot of people talking about, okay, I am an intern. They asked me to do many ICUs and floor months, and I don't get a chance to do subspecialty. Well, you try your best to get as much as exposed to subspecialty that you think you will go to eventually. If it's not a rotation, maybe a clinic. If it's not a clinic, try to talk to someone who's known in the subspecialty, who's well published, and offer your services. Just talk to that person and say, hey, I'm interested. Is there a project I can help you with? And believe me, now I am on the other side of the boat. I can tell you, we always welcome people like this, students or residents who are willing to help us in research and get published and get known and get that on their CV to help them pursue the fellowship. The other thing I would like to add about the subspecialty, and I always tell it to all my friends, think about the bread and butter in the subspecialty. In endocrinology, you can't say, okay, I like adrenal cancer, so I'm going to endocrinology. You have to like diabetes and thyroid. In just like cardiology, you have to like, chest pain all the time, whether it's a real chest pain or not. In rheumatology, you have to deal with pain. So you should like your bread and butter. In endocrinology, the thing that I can tell you about the bread and butter is it's a real thing. It's not a subjective thing. If the patient has diabetes, they have diabetes. And so they can't say, I have diabetes, and they don't have it. So for me, this is an advantage because it's a real thing and you can treat it and make a difference with all the treatments that we have now. So you can make a real difference in the patient health for sure. Endocrinology is not a procedure subspecialty. So if you're a person who likes to play with gadgets and do procedures, the only procedure we do is the thyroid biopsy, and not all endocrinologists do it. So that's also another game changer to think or not to think about endocrinology.
So I hear from you that research is important, and also I hear from you that we need to focus on the bread and butter, and we need to like those diagnoses, because we're going to see them all the time, especially as you said, diabetes and thyroid. So what were the main factors that helped you to secure a fellowship position, in addition to research and loving this specialty since medical school?
So the main thing, so as couple things here that I would like to emphasize on. First of all, when you're applying for endocrinology specifically, I hope you're not thinking that it's your backup, because all programs will know that. When all your publications are in GI or cardiology and you're applying to endocrine, they will know that. And they will not like that. And they will not offer you an interview. So so you should like the specialty itself and put all your efforts during residency to work your CV towards that pathway and get as many activities. I'm not saying publications, because it's so hard to publish. It's only 3 years of residency. We know how residency is. As much work in endocrinology as possible. So that's number one. The other thing, you also know you need a letter of recommendation from the program director, and it's okay if it's the generic one. There's no problem, because most PDs, most program directors during residency, they write the same letter for everybody, which is fine for any fellowship program, believe me, especially in endocrinology. The only problem is try not to make the PD add something to his template that is going to harm you, because they do that. they can put something that can harm you and alert other people against you. So a generic letter of recommendation from the program director is okay. And then the most important thing is a letter of recommendation from an endocrinologist. If you can get that letter from a famous endocrinologist because he's in your program and you worked with him, or because he's in some other program and you did the effort to go and work with him in an external elective, which many programs now offer, that would be the best. That tells us that you put the effort to travel somewhere and do an elective in endocrinology with that person who wrote you a letter. You don't have to get a publication for the fellowship. Even if you just started a case series or a case report with that important person you worked with, that is more than enough. And he mentioned it in his letter of recommendation. That would be more than enough to say this person is trying really hard to prove that he's interested in endocrinology. So that's what I did, actually. That's what I technically did. There was a big name in diabetes at Emory, and I worked with him on a case report, as simple as that. And we presented in a national meeting. And then I worked on some pituitary with a pituitary person also at Emory. And I didn't publish anything from that work in pituitary, but believe it or not, that work in pituitary is what got me to the Cleveland Clinic, because that attending graduated from Cleveland Clinic. So she put a word for me, let's put it this way. All that work was published years later, even after fellowship. So the publication is not the most important thing, it's to work with the people. Endocrinology is a small community, although it's big, but it's still small and people know each other. So when you work with someone who's known, everybody will appreciate that. I guess, yeah, that's it.
Oh, excellent. No, thank you. Thank you for summarizing it into those points. From your residency or your fellowship or even your medical career, did you face any challenges that you felt like they may hold you back, or something that's causing you any difficulties?
During residency, I guess, as I said, finding the time to do something to build your CV for fellowship application. But the good thing now is residents now apply in their end of second year, so that gives them more time. It's not the end of first year anymore. So that gives them a little bit more time. And as I said, and again, I say it again, try your best to do something to prove that you're interested, even if it's a 2 weeks elective somewhere else with someone or at a place. Like, for example, many people come to Cleveland Clinic, to our department, to do electives from all over the states. And they are residents and they do 2 weeks or 4 weeks. And during that time, they get to work in the consult service and in the clinic, and they also present in the grand rounds. Believe it or not, that presentation at our grand rounds, they give a point for it when we look at the application during fellowship. When we review the fellowship applications, we give an extra point for that grand round presentation that this person who is an outsider came and did when they were with us. So anything that would show on your CV that helps during residency, as I said, would be appreciated. That's, I think, the main challenge during residency. During fellowship, I think once you get to the fellowship, especially endocrinology, it's a relief. So not too many calls and acuity of care. So it's a very nice time. I think the challenges during fellowship apply to any fellowship is self-learning. So you're not following and attending like residency who's teaching you everything and telling you what to do all the time. When you're a fellow, you start learning how to teach yourself. So you have to read papers and prepare presentations and teach yourself. And that's why you see a fellow who is a superstar and a fellow who is okay. I think that's the main challenge during fellowship. And then, of course, after that is looking for a job. We'll talk about it with the rest of the questions.
Sure. So, so it seems like endocrinology is very challenging fellowship. No,
I don't want to make it, but let me tell you something about this specific point. Um, if you are pursuing a small subspecialty like endocrinology or rheumatology, my advice would be to go to a big place. Why? Because our diseases are rare diseases. You don't want to go somewhere where they make you see 25 diabetes patients a day in the hospital and you're not really seeing any adrenal or pituitary cases. When you finish your fellowship, you want to know all about your fellowship. You want to get exposed to everything so you know how to deal with it down the road. So my advice would be to go to the biggest place you can go to, the best place that you can get to in fellowship when you're applying to these subspecialties. So it's not hard, it's not super challenging, it's not cardiology or GI, but try to pursue the best you could from these subspecialties when you apply to them. That's what I would like to say. So it's not, and honestly, it's becoming, I mean, it's not easy anymore. I can't say it's easy. I can't say it's super challenging. I would say it's a little bit challenging if you're looking for something for a big program.
of course. So so after you finished a fellowship, you wanted to go to an academic practice, and I see that you stayed in Cleveland, and I would like to know, why did you choose academic practice over private practice?
So first of all, let me just tell you, academic is gives you a lot of benefits over private. I think private gives you a big benefit over academic, which is the money, but I can't think of anything else. While when you stay in academics, you get a lot more benefits, especially coming out of fellowship. You got the training, but you're not really, you know, like a what should I say, like a well-rounded endocrinologist. So you would like to stay, or at least I wanted to stay in an academic environment to learn a little bit more, be surrounded by other senior staff. The other thing, when you're in academic, you tend to stay more up to date. You have to put more effort in private to do the same, but in academic, it's always served for you. So there's always lectures, there's always things happening, there's always grand rounds and all these kind of things. A relationship with fellows keeps you always, you know, on your toes because you want to be up to date and you want to be, you know, available and there for them. So that was one thing. The other thing is the location. I wanted to stay in Cleveland for family issues. So so that was another reason. And then of course there is a factor that plays in any immigrant life, is the visa. So you want a place who would sponsor your, you know, papers. And not give you trouble. So I was at Cleveland Clinic and my papers were already there, so I just stayed with them. I just want to mention something. I hope it's the key point from this question. Your first job does not have to be the perfect job. Does not have to be your final job that you will retire from. I picked up a position that everybody was like, if they pay me $1 million, I'm not going to pick that position. This is what other staff were telling me, like, don't pick the job, because it was the way it was a little bit of a drive. I was covering like a faraway clinic and for 4 days a week, and I had only one day at the main campus, and that was the day with grand round. So it was a tough job, but believe it or not, my position changed in the last 3 years about 5 to 6 times, and I still look forward to, you know, improve it and change it and all that. So what I'm trying to say is your first job out of fellowship doesn't have to be the perfect job, and you will see time flies and things will change, and you will learn what you would like to have in the next 2 to 3 years, and you can always change. But see what suits you best. What's your priority? Is it the location? Is it being close to family? Is it getting the visa sponsorship quicker? So pick your priorities, and things will change down the road.
Sure. So now you told us just a little bit about your position, but can you describe one of your weekdays and one of your work days? How do you start your day, and how do you go to the hospital? What do you do in the clinic, and then how do you finish your day? If you can take me in a journey in that day.
Sure. So since you are in an academic position in endocrinology, you don't get, which is nice, I think, you don't get to do much hospital consults like private. So in private, if you have two other partners and you guys are 3 people, then you are on call for the hospital every third week. 4 people every fourth week, and that's how it works. In academia, it's different because it's a big number of people. So we do 4 to 6 inpatient consult services a year, and that's it. And during these weeks, you don't see outpatient patients. You just focus on doing rounds and teaching fellows and residents. The rest of the time, the rest of the year is all outpatient. And again, that's a favor because endocrinology is an outpatient subspecialty. So a regular day in my life is going to clinic from 8 to 5, seeing patients. What I do on Mondays and Fridays is I do shared medical appointments, which is a new thing now, and I really like it. The reason why is because you can see big number of patients in shorter period of time and finish your day earlier. So I do obesity clinic on Mondays and Fridays, and then the rest of the week I do just general endocrine clinic. I told you about the hospital consults. You do have academic things that get assigned to you, like lectures to medical school, lectures to internal medicine residency, interviews. So all these extracurricular activities, I think they are fun because they add a flavor to your day. So you're not like in clinic all day long, all the time, every day. You get to change. So that's about it.
So from what I hear, like you work from Monday to Friday, and what about the weekends? Do you cover any weekends, or do you have to be on call?
So your weekends are by default free unless you are on consult service in the hospital. Then you cover, as I said, so let's say 4 weeks a year you do consult service. So when we do them like 2 weeks at a time and then 2 weeks at another time. In these 2 weeks, you cover 1 weekend. So I think that's really easy. And then when you cover the weekend, you are at home, and I was never called to come in. Like I never needed to come in. It was always, the pager, and you answer, and it's about a sugar or a sodium level or like a thyroid storm or something like that. So you just tell the ER or whoever on call what to do, and then you come and see the patient in the morning. I never had to go to the hospital.
Sure. So from what I hear from you, do you feel like for endocrinology as a specialty, do you feel like there are any like from what I hear, I feel like you have a good lifestyle. That's what I'm hearing from you. That you can, it's easier for you to balance between work and family and your job and your home, and then you can have maybe some extra time with the family. Is that true? Is that what I'm getting?
Absolutely. This is absolutely true, especially when, as I said, you're working in academic position in endocrinology, because you don't get to cover the hospital as often as you have to do in private practice. So, as I said, your weekends are technically by default free unless you're covering the hospital. And then the other thing is the other advantage of endocrinology is, since it's mainly an outpatient subspecialty, then part-time is always an option. Of course, it depends from employer to employer, but most of the time that's an option. So if you want to go part-time because of family reasons, especially women, then that's an option. You can't do that when your subspecialty is an inpatient, right? So if you're on consult or ICU or something like that, you can't say, okay, I'm coming Monday and Tuesday and I'm not coming Wednesday and Thursday. But you can do that in endocrinology.
Nice. So, do you have any final words? I don't have any other questions, but do you have any final words or something that you think that maybe we didn't cover? You would like to let us know about it.
Let me see if we. One thing is, when you're working in academia, especially nowadays, things has changed. Back in the past, academic positions, they didn't really worry much about productivity. Now, productivity is a word that everybody's scared from and everybody's worrying about, because of a lot of reasons you guys know about. So even if you're in academic position, most academic positions now are talking about, okay, you have to see certain number of patients every day, certain number of new patients and established patients, and you have to bring the department certain amount of money and this and that. So in academia, same thing. It's not like, okay, this only applies in private. Same thing in academia, you have to meet your requirements. At the end of the day, the department has to, cover the expenses and make money. What I would like to advise in that factor is find your niche in academia. When you join an academic position, try to find something that nobody else does, that you can do and you like to do, and make it your thing. The reason why I say that is because that will make you more respected in the department. That will open big doors for you in academia as well, in terms of grants, in terms of national meetings. People get to know that you are the, let's say, the lipid person or something like that. And that as well can, as I said, help you get maybe in the future some funding, so you can cover your productivity part of it as from that. I can tell you, in my department, most senior doctors, they have funding from companies, they have funding from NIH or other institutes, ADA, to cover their research, and they cover their productivity, part of their productivity with that. And that helps a lot going down the road. If you just depend on your productivity, you will be tired working. You will be just working like a private practice physician, and you're just repeating yourself over and over again, and you will be tired. So that is my, I think, final advice for someone thinking about endocrinology in academic position.
Thank you so much. I really appreciate all the information that you shared with us. I will ask you one more question, but in the meantime, I would like to ask the attendees if they have any questions. You can type in the questions in the questions section. And we can ask Dr. Ula Abed Alwahab about these questions. So please go ahead and type in your questions. In the meantime, I will ask her this important question. So talking about productivity, let's talk about the salary range. And
right.
Like, let's say, I'm sure that when you were looking for jobs, you looked at the private, but I'm sure the academic positions as well. And I'm sure if it's visa dependent, it's going to be different from someone who has a green card or citizenship. So if you have an idea about the differences in salary ranges, and if you can share that with us.
Sure. So it's probably known that academic positions offer less than private practice, although this difference is not big anymore, because, as I said, academic places now are looking after productivity and all that. So it depends on the position in academic endocrinology. If the position is mainly just doing research like most of your week, then the payment is definitely not going to be much. The payment will come from somebody's grant. Let's put it this way. So we're talking about starting at as low as 120, and I was offered that 120K per year, all the way up to 200, 220, 230, and we're still talking academic position. From 120 to 200, you see all kind of different spectrum of area, as I said, mixing research with academic, with productivity. When your position is purely clinical and you're seeing patients in the clinic and you're not assigned any research projects or anything like that, then you get to 200 or 220K per year in academia as well. Now, private starts, of course, probably 200 and above. 200 and above. Salary. Some academic places offer fixed salaries, some other fixed salary with potential bonus. It depends on the location. My position is just salary. There is no like bonus or anything like that. But as I said, they pay very well because they look after the productivity.
Sounds good. So we got our first question, and they're asking if what do you think about the between pediatrics and endocrinology for a female doctor from the lifestyle and salary ranges?
They're asking pediatrics versus medicine endocrinology, probably.
Yes.
So probably the lifestyle will be pretty much the same. The payment will be definitely different. Pediatrics is always less than adults. And I think it depends on what you like. Do you like to deal with babies or do you like to deal with adults? For endocrinology in specific, I can tell you dealing with adults is, from my standpoint, is easier and you can do a lot more. Let me tell you something, Muhammad. When I went to the faraway clinic that I told you about, they didn't have a peds endo, so I knew that during fellowship, end of my fellowship, so I did some endo peds rotations to get some exposure because I knew I will have peds patients. And I can tell you, you can't do much in peds endo because there are just little bit amount of evidence of studies done in pediatrics. For example, pediatric diabetes, there is not much you can offer them. I mean, metformin probably the only medicine you can give them, all versus all the new things that we do in adults, all the great medicines that we have now in adults. So I see pediatrics a little bit limited in that matter in endocrinology, but I think the lifestyle is pretty similar, but the payment is definitely less in pediatrics.
Yeah, sounds good. I mean, it seems like the lifestyle in general, it's really nice in endocrinology, and yeah, you can have the chance to enjoy your life. In the same time, you can enjoy your work, and you can work in the clinic, and also you can get some time in the hospital. And that's actually leading me to the next question that. You're asking that I'm interested in endocrinology, but I enjoy inpatient medicine as well. So is there a halfway between them?
Sure, absolutely. I see that more of a private practice setting, which is most private practices now in endocrinology, they do a lot of hospital service. And the reason why is honestly financial, because billing for inpatient pays more than billing for outpatient. So that's why most private, they make you do hospital like every 4, as I said, or every 5 weeks. So I see that very well done in private practice in endocrinology. There's no problems. If you like hospital, believe me, you'll find 1,000 jobs for endocrinology inpatient.
Excellent, good. So there's always an opportunity to work inpatient and outpatient, and that's actually one of the good things about endocrinology as a specialty, so you can enjoy both at the same time. So another question they're asking, are there advanced fellowship after the 2 year of endocrinology? They're saying like lipid, reproductive, and obesity.
Right. So there are, but in limited places, and they are mostly to do research. It's like you spend extra year to do research in one of these areas. I know Hopkins has an extra year in pituitary, but you have to be a citizen or a green card holder to do that, and you have to. They are not going to pay you, basically. I mean, you're like you're joining like a research fellow, pretty much. There is a neuroendocrine fellowship at MD Anderson. That's a third year as well. Those are actually the ones I know about. Reproductive endocrinology is actually part of GYN. It's not part of endocrinology, unfortunately, again. So, so actually, I am a person who, like I told you about the niche. My niche is PCOS, and women health has always been my interest. And unfortunately, it's over the years it changed from endocrinology to GYN, but we're trying to get it back. But anyways, so reproductive endocrinology is a subspecialty that you join after OB/GYN residency, not endocrinology.
Yeah, so I actually was I was surprised that at University of Massachusetts we have a lipid clinic. So we have
Right.
a clinic only to manage hyperlipidemia, and I'm not sure if maybe you have that at Cleveland Clinic. So usually that's endocrinology, someone who's like who
Yes.
likes to manage hyperlipidemia, so they do that only. Or something like that,
Yes.
or maybe they do it like once a week.
So yes, let me tell you. So one of the reasons that really attracted me to Cleveland Clinic is the how subspecialized the program is. So we have a thyroid clinic, we have a calcium clinic, we have a pituitary clinic, we have a lipid clinic, we have an obesity center now, we have a PCOS clinic now. We have what else? I mean, all kind of clinics. So you, as a fellow, you rotate through all these clinics, and it's not only just general endocrine clinic, and that's what I would like all people who are applying to get exposed to. That's why I said try to aim for the biggest place you can get to, because that's how things are. It's not just general endocrinology clinic.
Nice. I feel like I should apply now to endocrinology.
Great.
I changed my mind now. No, I mean, I think getting the exposure actually to all these subspecialties in endocrinology is fantastic. And I'm sure that not all programs will offer that. And Cleveland Clinic will definitely offer all these subspecialties, so you can get the exposure and make you ready for the future if you want to go into private or academic. So it doesn't matter, because you got the knowledge and you got the exposure.
Right.
Thank you. Well, I mean, so far we had. So, how friendly is Cleveland Clinic Endocrinology Program Fellowship with IMGs, and who is the ideal candidate to get fellowship there?
We are very friendly with IMGs. I can tell you that it's not only endocrinology; it's Cleveland Clinic policy. They really like and appreciate and respect diversity big time. For the best candidate, we're looking for someone who does not want to end up being a basic researcher in endocrinology, and I'll put it out loud there. We are a heavy clinical fellowship, so we will teach you a lot about clinical endocrinology, but we also would like you to do clinical research. So the best candidate would be someone who has a good clinical background. So they did well during residency and all that, and they also did some clinical, as I said, some clinical research, some clinical work that was presented at a national meeting or something like that. Honestly, our criteria changes every year, and we meet every year and we change things, but we always look at scores, USMLE scores, and we have a cutoff for that. We then look at letters of recommendations from endocrinologists, as I said, and we look at papers / publications / national meetings, stuff like that. So,
out of curiosity, how many positions you offer a year at Cleveland?
It's 3 positions. So we have 6 fellows at any time. 3 first year and 3 second year.
Mm-hmm. Yeah, that's a decent number of fellows. So another question is PCOS for endocrinology or OB/GYN?
So I think, well, you're asking the wrong person. I think it should be endocrinology, because the way GYN, and this is not to be negative about anyone, but the way GYN think about it is, does that patient need surgery? Does that patient need IVF? Otherwise, their treatment is standard for it, which I honestly don't like, because I think these patients deserve a little bit more tailored therapy for them, and we, the people who deal with hormones, will understand it a little bit better. So I think the collaboration between both, and that's what we're trying to do in my own clinic. So we have collaboration with GYN / reproductive endo department. So the collaboration between both would give you the best results. Let's put it this way.
Nice. Maybe next time I will interview and have a guest from OB/GYN, and I will ask him the same question.
No problem.
Well, I would like to thank you so much for being with us, and I'm really grateful that you joined us for tonight, and we had a really wonderful time, really amazing information from you. I really appreciate the time that you took to be with us. Thank you so much. I really appreciate it. If you have any final word, we would like to hear it, and then we can finish our interview.
Sure. First of all, thank you so much, Mohammed, for this great opportunity. I also enjoyed the meeting, and the setup was really nice. One last word: if you're interested in endocrinology, whether you're a student, resident, and you would like to come to our department to do a rotation and see how things work, I will be more than happy to help. Just let me know, and please let me know as early as possible. And I'm talking about months before you intend to come, because positions fill very, very quickly. Even if you're looking for an observer or elective or whatever it is, and whatever stage you are at, student or resident, let me know. I'll be more than happy to help you, but please consider the timing before you come.
Thank you so much. I really appreciate your time and all the information you gave us. Thank you so much, and thanks for the offer to help people to get an elective rotation at Cleveland Clinic. And we hope we see you in the future, in other interviews in the future. Thank you so much for everyone who attended this session. This is our first episode, and I would like to thank you for listening to us, and I hope you enjoyed your time with us, and you learned a lot about endocrinology. Our next session will be, inshallah, about cardiology, and we will have Dr. Zahir Fenary, who is a structural heart disease specialist, and we will announce more information in the future. Thank you so much, and have a good night.